I'm going to talk a little bit about lean government, but actually in today's context, perhaps the public's going to think of it as a mean government. We all are aware that we're in one of the deepest financial crises that we've seen for some time. And actually what we're doing at the Design Council and what the hell has design got to do with lean public services and public sector delivery is a very good question. I'm going to try and take you through very quickly on a canter 2 case studies, but also the programme that we're running to try and deliver good design into well-designed public services into the public sector. And I'll start off with this. Dear Chief Secretary, I'm afraid to tell you there's no money left. This is the infamous Liam Byrne note to the incoming government to say, look, we're out of cash. All done in jest, but actually all taken very seriously. But actually, customers' expectations are still incredibly high. And with rising unemployment and the various other indicators we have to deal with the facts of life in terms of delivering the public services that we now have an expectation for. And people's perceptions are their personal realities. And that's something about putting the customer at the heart of everything we're doing moving forwards. What's the agenda? It's more for less, or somebody else said to me, with less do more. And therefore, we must think about some rather radical ways of getting through this maze of activities that we need to get through to get these new services out there with the constrained budgets that we have. So I'm going to do this in a slightly different order. And I am under a sort of slightly difficult time constraint here. So I've actually put this presentation in reverse. I'm going to give you the lessons first and the boring bit about the Design Council last. So actually, instead of all the creds and everything else at the beginning getting to a big crescendo, I'm actually going to go in reverse order and say, this is the learning that we've got. Hopefully you can do something with it. Feel free to ask questions and take the case studies. They're all available. But actually, let's just take it from the top. So the learning. What's the learning told us from our own programme of designing new public services with local authorities, with national departments? And those are the 2 aspects I'm going to give you this afternoon. Firstly, we have to put the customer and the end user at the heart of the project from the very outset. Unless we're actually at grassroots level, it just isn't going to work. Provide the environment where creativity can thrive, focus on the outcomes and the goals. I was with a contract on offender management earlier in the week. There was a contract to reduce reoffender rates. It had 506 managed criteria in the delivery contract. Completely unworkable. Understand failures and unintended consequences. Not everything goes well. We've got to have an expectation that some things need to be tried and won't always deliver the instant results. And also take a slightly longer view, although we can get some quick win results out of this as well. Also, provide and identify the project leadership, sort out procurement for the little guys. 2 fantastic stories. One of a parish council wanting to take over hedgerows, lawn management of the cemetery. It can't do it, it doesn't have public liability insurance. So actually, how do we work through this red tape? How do we work through this bureaucracy? Again, offender management services can't clean graffiti up over 6 feet high unless you've been trained in the use of a stepladder. So actually, the obligation is to actually understand how to unpack these systems and get through them to get the results that we really want to have with these outcomes. Also providing clear rules of engagement and disciplined support. It's not a case of just putting this big society kind of shift of activity out there and thinking it's going to work first time out. These are startups in many cases. Startups are prone to failure and they need some support, some mentored guidance and some assistance to help them get on their way to be successful for the future. Some thoughts on design. The design sector actually contributes an enormous amount to GDP. 232,000 designers in the UK registered, but many, many thousands of businesses in various different disciplines. But the processes themselves, they're free. We publish them, the trade bodies publish them, there are lots of different approaches here. But designers bring valuable qualities. They do tend to think of something, certainly in the private sector, taking over to the public sector in terms of putting customers first, being competitive, delivering great services, great brands, great offers, great products. And they have asked me to say that whilst they do charge for their services, they are reasonably priced and terribly good value for money. I'm just going to run you through 2 case studies now, very, very quickly again. One on service design, which is a local authority, tiny, small project. And then another one on a sort of product industrial piece of design for the NHS and a major government department. First one here, public services by design, this is the programme. What are we trying to do? Achieve innovation in the public sector. What's the question? How can design transform services? Who's asking? Cabinet Office, biz. Who's helping? Frontline staff, very importantly, customers and the design experts themselves. Lewisham, the Housing Options Centre, standard chewing gum off pavement, brick weave over the threshold, standard documents inside front door, battleship grey paintwork. The sort of thing that we all know and recognise, but actually quite a hostile first event. It's not like walking into the Apple Store in Covent Garden. But actually, what are we trying to do here? It's about improving users' experience, doing more, and reducing the number of people accessing housing services with less, helping them help themselves. It's a bit of a warm-up act, I suppose. What did we do? We took a diagonal slice project team involving cross-functional improvement groups, public sector partners, the third sector, the parish council, lots of big tent inclusiveness of the people in the community, senior execs, service managers, frontline staff, and of course the customers. And by doing this, we put a project together which generated 100 ideas of how this single, small, little service could improve its own offer. As a consequence, 3 specific pieces have come out as priority projects. A right first time welcome. Basically, everybody was walking in up to a 4-hour wait for a 5-minute meeting, often with no outcome. Pretty desperate stuff. Taking A&E, taking best practice in other areas of the private sector, the triage system, a very, very different approach of streaming people according to their needs and prioritizing people according to their priorities as they walk through the door. A sort of what's up doc, what's next doc documentation process. How do we actually reduce the stress of people walking through the door? Staff and user interface. So we tested multiple prototypes for the easy-to-use record keeping. Little cards so they could be passed between members of staff depending on when people came in. If you weren't served by the same person, how do you pass it on that isn't a sort of wodge of grey file? And people like me storyboards, actually telling the stories to people on the wall while they're waiting to see what's going to reasonably happen to them and go. And just to give you an example, on the left-hand side, this storyboard is now a mural on the wall. So as people are sat waiting, they can see exactly what is likely to happen to them if they're in that particular story. And there are other stories through the course of the centre as well. You can see also some of the cards in the referencing system. Very visual, very graphic, very simple, and actually very visual because what we found was English wasn't always the first language. So by unpacking all of this system and process, we can basically get to the heart of what the customer really wants to see and actually achieve value. But the outcomes are very specific. Specific reductions in temporary accommodation, the capacity of the system they needed to accommodate, the time spent in temporary accommodation, registered homelessness, and homelessness qualifies from I've been kicked out of my house 2 hours ago to I'm long-term homeless. There's a whole continuum of people in this system. Team absence, frontline staff who basically stress levels, confidence levels, needed a day off just to recharge the batteries. All of this being affected by virtue of this programme. Improved routing to appropriate services, the navigation to the third sector, to the parish council, to the other services there, consumer waiting times down, and the targeting of resources to those in greatest need, something we find often. How do you take extra care for the vulnerable and those really in need? And increased capacity and confidence of that frontline team to be empowered to act and actually change things. And they're taking these processes forwards to go through their other 97 ideas to see which ones they can also enact. So one example of one very small service, frontline, that the team themselves, the frontline, have actually worked with designers to actually change it. And I think the most important thing here is we ran this pilot programme in the last year. It is likely to expand in the following year. £30,000 worth of a project, £750,000 average return on investment, social return on investment 26 to 1. And very simply, that's cheap, that's a lot, and that's amazing. So a little intervention can go a long way. And that was a 1-year ROI. That is not a one-time saving. That is an ad infinitum saving of a change of a service. The next project I want to run you through, open innovation. A big employer and a big wicked problem, MRSA, £1 billion a year in the Department of Health, hospital-acquired infections, HCAIs as they're known, lots of jargon. But MRSA, C. difficile, that's what we're talking about. And actually the problem we had, to set up the project in its first place was what is the cost of this? What is the consequence of this? How much is this going to cost? How do we get into the middle of this system? So we put a bit of a fun title around it, Design Bugs Out, going back to the cartoons and the visualizations. We wanted to demonstrate the practical power of design. Could we specifically reduce the transfer of hospital-acquired infections? Could we stop it happening in the first place, get in the middle of the system? Who was asking? The PM, Sex State Health, and the NHS themselves. Who was helping? Again, patient groups, frontline staff, designers, technologists, manufacturers, and the healthcare specialists. So again, big tent, inclusive approach, round the table, what's going on? Not the typical beanbag post-it note that we're all used to, but actually, really good dialogue, good, strong conversation, evidence-based.